A very good evening to everyone. This is your host, Kopi With Vans. That's it. I am back again with a different topic again. Hope you all are having a fantastic evening. One of the best, greatest thing is we are going to talk of a great topic today. With me, my guest speaker, Dr. Arvinder. I mean, you all should know who's Dr. Arvinder. He has been in our show for a couple of times. He has came and talked about, I call him the statistics doctor because he comes with a lot of statistics and he comes with a lot of different topics on a weekly basis. And he's also one of my regular speaker right now in Kopi With Vans in terms of when we talk about medical science, so and so forth. So he's going to come in a bit, but as today's topic, if you look at it, it is all about what you should know about eating disorder. A lot of people do not know what is this eating disorder, but what most things that it's something like you're going on a starvation or even for a period of a short while, but it's not. It's more to it. So without any further ado, I'm going to bring up Dr. Arvinder up in a while. But before I do bring him up, I'm going to talk a little bit on the bulimia itself. Because if you look at the different aspects of bulimia, all right, we need to understand what is bulimia is all about. Bulimia is a serious mental illness where it can affect anyone at any age. So it doesn't really have a certain age, right? Gender or intensity or even background or people. With bulimia are caught in a cycle, eating in large quantities of food called binging and trying to compensate for the overeating. And most of the time, what happens is that bulimia, we call it the nervosa. It's more like after eating, you will never know who they are, right? But what they will do is they'll go back and then they try to purge it out, right? They try to warm it up. It's actually quite a mental situation where it is actually not only affect them, but it is their lifestyle, right? They think they are eating too much or eating too less. So that is actually basically what is bulimia nervosa. And it's also a lot of stuff that we can talk about excessively called purging out. You're trying to, after eating, you're trying to vomit it out. And also at the earliest possible opportunity, give the best chance of for to recovery from that particular bulimia, right? I still remember that during one of my courses that I was doing a sports science, and one of our project was to interview a bulimia and anorexia patients, and then we have to come up with how we talk to them and how we understand the situation. So the way they have a perception of thinking is totally different. Regarding about the hormones, how it affects a person, I'm going to let Dr. Arvinder to come in and talk in detail about that. But we also need to understand what is anorexia, right? Bulimia, we all know, nervosa, is pretty much after eating, you can purge it out. To be more crude, you can warm it out, right? You put your fingers inside and then try to warm it out, whatever you eat, and you feel that the particular person feels that it feels better for them. But the other end, when we talked about anorexia, also the nervosa, trying to stay thin as possible by routine. So refusing to eat, or even if they eat, they quickly go and do cardio, or they will try to burn as much as calorie as possible. It is also an eating disorder that can eventually break down both mental and physical health as well, to a point where the starvation can be fatal. What we do understand in the past, when I encounter that this particular person is extremely um, malnutrition, and then people tend to give judgment and remarks, something like you're skinny, right? You have mental issues, you are, to be even crude, they even call it like you are psycho, you're mad, so and so forth. But for a particular person to be in that situation, they might be going through a hard time. It's not they want to, right? But it's how we think, right? When you look at the mirror and you think, hey, I'm beautiful, you are beautiful. If you look at the mirror and say you're not beautiful, you're not beautiful. This is what we think. And unfortunately, or the fortunate thing is that even for anorexia or bulimia, there's a situation that's happening within them. They need definitely help. They definitely need help. Just to give an example, for an anorexia patient or a person who's suffering from anorexia, they tend to eat as much as little as possible, and because of that, is malnutrition, and they lose a lot of muscle mass. Probably you can actually see them as much as a skeleton. That's a bit serious, right? That's a very serious health condition, right? It can lead to fatal. I do even know that particular person, after eating a little, they're going to try to burn it up. So you can look at them at an extreme situation. What actually causes this? All right. In my previous talks with different experts, doctors who come in, it's all about our hormones. It's all about our chemicals in our brain and all our body, right? Sometimes we can be angry, sometimes we can be sad. That's a part that is more on the low side. But serious things, if we don't address this issue, we can lead to a little bit more dangerous kind of situation. So, anorexia, we all need to understand that the starvation can be fatal. It leads to a lot of malnutrition, and also, again, there's no age, there's no gender, and also no race, right? What causes anorexia? It's still a bit puzzle, right? I'll get Dr. Arvinder to come and talk about it, but it's more on disorder circle around the food, or the root of the problem is more on psychological. With anorexia, you severely restrict your food. That what is for sure, we all know. But what actually causes this, right? Let's invite Dr. Arvinder to, he has some presentation for us. So let's hear what our doctor statistics have to say for us, because today is not about statistics. Today it's more about the in-depth understanding of eating disorder. And just to talk about Dr. Arvinder, he's currently doing his PhD in a particular field, which I will ask him to explain to us. Dr. Arvinder, come on, sir.
Hi,
How
good
are
evening,
you, sir?
everyone. I'm okay, sir. How are you, sir?
I'm good too. It's good to have you in my show again.
Thank you.
So, Dr. Arvinder, I was just talking to all the audience today. We're not going to talk about statistics, but rather we are going to talk about eating disorder. I do know that at this current moment, you're still. That's the thing about doctors, right? How much you graduate, there's no graduation, right? In a medical field, there's no such thing as I'm done, right? There's no, right, doctor?
It was always told to us that when you start your medical field, that is the day you open your books and you keep your books open and you keep updating your books and make sure that you keep updating yourself, because medicine is a evolving and changing field. Even when some of the definitions which you have given, like anorexia nervosa and even sorry, anorexia and bulimia nervosa, the definition has changed actually in DSM-5, and there's something called ethnos. So I will touch all of this on my lectures, in my lecture, very very short lecture today. But it is amazing that the more you read, and the I've embarked in my PhD in epidemiology and statistics, but my main topic of what I'm going to do is basically in adolescents health, mental health, and also in eating disorders. So the more you read, there's a theory that you say that you think you know something, and the more you read, you finally realize that it's so little that you actually know, and there's much, much more out there which you need to do. So I will share with you the very little I have embarked and read, which I think is a problem. I would say in developed countries like Singapore and Malaysia, we may not have got at much awareness yet. But I think as we move along, we will actually see more and more of this. And if you think about it, finally after this lecture, or even after you hear about it, and then you say, did that patient have a eating disorder, or did this guy have an eating disorder? And unfortunately, at this particular moment, you will actually need a professional assessment. We are developing scales which we are hoping that the public can one day just do themselves, like how they do the DAS scale, and find out whether they're having depression, anxiety, or stress. But I think at the moment it is up to professionals. So I think a professional's high index of suspicion is actually what will actually clinch the diagnosis. But it is also important that other people recognize this disorder so that they can actually get these people help. I think that is where we would like to lead to today. So I have prepared some very few slides here, hoping that I can share with you guys. Just give me a moment, please.
But just before we dive into the slides, I mean, for all those
Sure.
viewers who are just tuning in, please do share this video because, like I said, every week we have a different speakers coming on board and talking on different topics. Dr. Arvinder is one of our guest regular speaker who talks a lot more in depth into situations not only on COVID statistics, but he also talks a lot of pertaining to the body. He's the subject expert in that field. So please do share this video so that your friends and loved ones can actually benefit. And of course, the last 15-20 minutes we have all the Q&A, so please feel free to ask all those questions to us, and within our best knowledge we will try to answer them to you. Thank you so much all who are just tuning in. Thank you. But doctor,
Yes.
like I was telling earlier in the talk before you jumped in, during my course that I was doing in sports science, we got to interview a bulimia person, right? And
Right.
the way they think and then the way we think is different, right? But
Yep.
unfortunately, the society right now it's giving a lot of judgment. If someone is big, the first thing they come and say, which I normally don't say the word, fat. You are
Yep.
fat. And then when somebody is extremely small in size, they call it you are skinny. So we see this
Mm.
kind of judgment actually is very hurtful for people, right?
Yep.
I think as a society, I think we should refrain from using the word fat or even skinny. For someone who is very fit, they can use all kind of words, but you got to think the other side, right? That person might be going through a very difficult position right now. Even if someone is in an anorexia, if you're going to tell them that, hey, you're very skinny, they don't believe you. They think they are still in a bigger size. So I
Right.
think the judgment and the remarks, I think we should put it aside. And even if you get it, I think you shouldn't be getting it too deep into your heart because that is an additional stress of emotional stress, right?
Yes. Stigmatization, I think that is the biggest thing here because a lot of people, when they're overweight, I can tell you honestly, Vince, I was actually 140 odd kilos about a couple of years ago. And I actually went on a weight loss program and I lost about nearly 50 kilos. And I've seen both ends of it, Vince, where I was actually very large, and a lot of people say, "Hey, you're so unfit, this and that." And then when you start losing weight, and then when you're slightly on the other side of it, hey, what happened to you, lah? Are you on drugs, or are you on something? That type of thing comes out, and the stigma attached to it is it's a lot. A lot of people start questioning your health status, and I don't think it's only at one end. I think it's at both ends of the spectrum. I feel bad more for ladies because I get a lot of ladies who have come in who are slightly on the larger side who want to get fit, and that is very important. They want to get fit, they want to do something about it, but they get disheartened with a lot of comments. And the other thing is, a lot of them they actually start saying that, hey, I always wanted to wear a particular dress or a particular outfit, but I can't fit into it, or I can't find my size. Or when I wear, people keep saying, "Hey, I look like that and I look like this," which is a bit sad in such a modern age society where we are supposed to have progressive thinking. We can talk to each other without meeting each other, like how we are doing right now. But we are still stuck in the age-old stigmatization of where we see people by their body weight. And I think there was one particular study or a couple of studies done where people actually perceive the way they actually look at the next person without even saying a word. They can actually perceive that person by their body shape. And unfortunately, humankind has taken that turn, which I think needs a very large reverse. And I think that is why we have to have one of these talks so that people understand that there's a eating disorder. I think bigger than the eating disorder, than the shape and outlook, is actually the health status of that person. You want to avoid metabolic conditions like diabetes, hypertension, dyslipidemia, obesity, associated obesity linked issues, cardiovascular issues. So I think that is the bigger picture. I think society has some way to go at this moment. Um, Stigmatization, especially public shaming. I think it is not when a person tells one on one. Maybe there may be some good intention, but when public shaming comes about, especially if you look at social media these days, a lot of public shaming has come about, which is a sad way our society has been driven. So There's a lot of
And
work.
doctor, I think to add on to that, I think one should not be too take it too hard. All right, they say don't take it to the heart. Then you will start to feel the emotional. One will start to give all kind of comments nowadays, right? They give all kind of comments. I mean, I'm
Yeah,
sorry to use these words, but words like fat, you are skinny, you are ugly. All these can lead to additional stresses if you take it to your too heart. You know that if you are slightly in your weight, if you are underweight, doesn't matter, as long you're feeling comfortable, and if you know that you need help, please go and get help. But do not let these remarks and these judgments and so on and so forth to affect you, and then it leads to another stress. We already have pretty much of good stress nowadays with COVID. We don't want
yeah,
these additional stress to come in.
I agree.
Unfortunately, there are a few cases also in not in all gyms in Singapore, even in Malaysia, but I think there are few, right? I think as a doctor, I mean, most of the professionals, either in the fitness trainers or coaches or even doctors, I think one look, if you identify a person who is pretty much more on very close to skeleton, which probably because of malnutrition, I think probably the person may definitely need help. But it's just that sometimes when you approach them and you say, "Hi, ma'am, are you okay? Are you sir?" They probably do not want to talk to you because to them you are totally a stranger, and then they do not welcome you. Any of the comments, even if you say you need help, they probably will not get it. So I think the loved ones should be must have the ability to understand and identify what is your other part of your loved ones. Even if you have a friend, after a long time you seeing him, and he is like when I mean he is extremely in an underweight, probably there's time to ask a few questions to the loved ones and identify what's the problem. I think lack of communication, a lack of love, we call it the TLC, that tender loving care, is not there. So I think a lot of people are going through a lot of depression nowadays, a lot of depression, a lot of stress at this point of time. What is your take on that, doctor?
Exactly. I think you hit the nail right on the head there. I think the most important thing is family to actually watch out for each other, friends to watch out for each other. I think uh, it's a tough thing. You get a lot of people who stigmatize when you come, and then I had a patient about I would say 2 weeks ago who I diagnosed with diabetes, and the patient was only 17 years old. And I said, I have to diagnose, I have to do a blood sugar, and he was so convinced that he is not having diabetes. And I said, no man, let's just check. And when we checked, he was having diabetes. In fact, he was actually having very very high diabetes. In fact, I had half a mind of starting him on insulin. And when I spoke to him, he said, "Doc, I can't be having diabetes. You look at my body size. I'm so thin. How can I be having diabetes?" And that is my greatest fear. That with a lot of eating disorders, anorexia, a lot of people with anorexia doesn't mean that they don't have diabetes. They may be having diabetes, which may worsen their condition. And a lot of them may actually end up dying if they succumb to the disease due to hypoglycemia, which is low sugars in the body. And and because of that they actually get diabetic ketoacidosis, and it's supposed to break down the muscles, and they don't have any muscles to break down. They cause osteoporosis. The ladies, they have disordered menstruation. The list goes on and on and on and on. So eating disorders actually is not only linked to, I won't say it's a standalone disease. You will never find a person who has eating disorders and that's it. But they will be having anxiety, they will be having stress due to other external factors. But when you a lot of people, when you go about talking about a patient and then suddenly say, oh, you're having anxiety, oh, this person is having stress. But when you look at it, actually the person has an eating disorder which is leading to all of this. So if you actually treat all the rest of it but you don't treat the eating disorder, mind you, it will actually come back again. So that is why it's very important that when family and friends actually recognize that, hey, this guy may be having an issue. And honestly, the faster you pick it up, the faster you get help, professional help, you will find that their recovery is actually much much better. So exactly, I think it should be forthcoming. Unfortunately, due to our society events, people like you and me, when we approach people and say, hey, you know what, I think you should get help, because of what society is doing to them, everybody keeps calling them fat or keep calling them thin, they become very they become very they shun away these people. And even though you're trying to do good for them, or you're trying to get them help, they actually shun you away because they feel that you're one of them. And that is what actually worries me about society. It because I think they get rid of people who actually want to help, and it becomes a problem. That is why I always tell people that if you think that you can't help, best that you, if you have nothing nice to say, best you refrain from saying anything. If you have something nice to say, you have got very good intentions, I think you have to be very tactful about it. So I think exactly what you say, choosing the words very carefully is a, it's a big issue here.
Doctor, I think you also bringing the spot on. When we talked about at things like judgment and remarks, of course we want to talk about all these first before we dive into the actual presentation. But why we are bringing these judgment and remarks, because this is the thing that we are commonly getting in the society. Most of the time you're getting in the society, especially someone who comes to a gym to exercise and he's probably about 50 or 60 kg overweight. All right, the last thing you want to hear is someone calling him, you are fat,
Right.
because probably he knows, he already heard that 1999 times. So we got to be very careful. Even
1995 times on that day before meeting you.
Yeah, probably yes, doctor. So he probably hear that, and that's why it's more on inferior complex. They
Yep.
never feel superior at all. They always feel inferior with low confidence,
Yep.
and a lot of other factors comes in, right? Low esteem as well. But that also can lead them to a different topic, which can go into weight losing pills, or even steroids, or even some chemicals where the ENT, they prescribe, things like clametrol, which is a very highly chemical substance for losing weight. No, it's not losing weight. It's using for the respiratory system, right? The bronchial tubes are inflamed. So you see, there's so many things can come in during the losing weight or even to gain muscle. But that is a total different topic that we will be going in. So yes, doctor, I think we should dive into the topic today. And what is the main factor here? What actually causes these eating disorders, either for anorexia or bulimia? Your
Uh,
presentation, doctor.
yeah, there are a couple of things which I will share with you. Just one moment. So I'll just
Eh,
very quickly share with you. We are talking about eating disorders today. This is my Twitter handle, my LinkedIn, and my email if you need to get into contact with me.
Okay. For
So,
all the viewers, please keep on coming up with the questions, because thank you, Shamla Devi. There are a lot of other more questions that's coming in and sending it to us. So we will definitely will answer all that so that we can keep it more and consolidated. Already, I got 5 questions coming up, so which is good. Please keep the questions coming in. Please do share the video so that more people can be engaged. Thank you so much, Samir Singh, who's just walking in. Saraswati as well. Thank you so much. Okay, doctor, all yours. And
sure.
I'm going to bring
So,
in the slide.
all right. So, basically, can you see my slides?
That's right.
Yeah. So eating disorders, as you can see, there are many other things. You have anorexia, bulimia, but as you look at it, you will see anxiety, low self-esteem, depression, body dysmorphia, media control, mental illness, perfectionism, guilt. You have binge eating, which is another disorder. But the problem is, eating disorder may be the main what you call the main root of this problem, but at the end of the day you will see that it can branch out into so many other different things. So I think eating disorder is it's a root problem. You may not actually get eating disorder, you may get other things like depression, anxiety, but it roots down to eating disorders. So I will just give you a very brief introduction, but before I do, there are 4 take-home messages here. I think eating disorders, if you think about it, may be more common than we think, and eating disorders can affect anyone. And eating disorders needs attention, immediate attention, and early assessment and treatment has better outcomes. So these are the few take-home messages. So let me just give you a introduction, and I would just like to remind the viewers that my references for the slides will be at the bottom, so you can actually have a look at them. So eating disorders have been an issue ever since. In the past, they always think about eating disorders only being associated with females. That is why the ladies always wear girdles, they try to look thin. And I think that's a bigger problem these days, because we have stereotyped it. And we always, if you hear our grandparents, you hear people from the past who always say that, oh, yo, girls, oh, you shouldn't eat so much. Oh, you please cut down your rice. Oh, yo, you don't want to be fat. That sort of thing has come and hit. And I think it's even taking effect to the boys right now. But I think at the moment, internationally, it's safe to say that unfortunately, eating disorders is always associated with the ladies. and it's poorly picked up because it's poorly understood. Maybe about in 20, 15 or 20 minutes ago before we started the show, you may say, hey, eating disorder can be anything. But now you go and say, hey, you know what, there's much more to eating disorders. And the problem is maybe it's poorly picked up. And it's difficult because people are suffering it from it. Sometimes they themselves are unaware. They're not sure, hey, what's actually happening. They don't know. They think it's normal. They think they think it's absolutely fine. I mean, who won't want to lose weight when they're big? But how much have we gone? Have we gone too far? That's also another problem. So these are all minor issues which we're going to have to pick up. Now, it's important to classify right as modes of treatment, goals, and recoveries differs from each other. You must classify it correctly because the modes of treatments are completely different. And fortunately, there are some skills developed to identify eating disorders, either interview or of in-depth clinical interview. But at the moment, there's nothing. To my best of my knowledge, there's nothing which you can do by yourself. So you normally need a professional assessment. So we'll just go into some of the very brief definitions, which Vance has also brought up. We have anorexia nervosa, bulimia nervosa, and binge eating disorders. Please note that I'll be using these abbreviations from now on. So what is anorexia nervosa? Basically, it's very simple. Basically, the calorie intake is reduced. The calorie intake is very, very little. If you see a lot of people say that I want to be a supermodel, I want to get a size of a supermodel. And when you see the supermodels, if you see some movies or you see the way they talk, oh, I ate a whole celery today, I'm very full. Or I ate a salad, oh my God, I'm not be able to eat for the next 3 days. That sort of thing. But the calorie intake is actually very, very low. People understand will ask me how much is adequate calories. It depends on your burnout, how much you're working out, how much you're utilizing. Of course, if you would like to lose weight, your calorie intake must be lower than how much you burn, so you get a negative balance. But if you keep doing that, you will go to a point whereby you don't even have stored calories in your body anymore. How do you burn it when you have nothing? Can you imagine that? For you to have money or for you to have a growth of wealth, you need to spend less than the money you make. But at the end of the day, if you look at it, if you keep spending, there is nothing left to keep. So what are you going to spend from? So that is also another problem. But I think
Doctor,
yeah,
I'm just going to pause you for a while.
sure,
Even in the fitness industry, people do take certain products, right? Which
supplements.
is of course off the shelves, or even if it's not legal. But that
Right.
actually accelerate fat loss. That's for sure because that is prescribed by doctors. But what do you think those things that is not prescribed by doctors, but these individuals take it? What do you think about that weight loss? Can we add them into anorexia? Because these people desperately want to lose weight, but then they go off shelves and take certain products that is not prescribed by doctors, which is supposed to be prescribed by doctors, but they take it and it can lead to overdose and fatal. But we're not going there yet. But what is there also a mental issue, or the particular person is having an issue with that?
I think that is more of a. I think that is more of an obsession, Vance, because anorexia is when you already have low calorie intake. I think maybe what you are describing may go a little bit into bulimia, because what happens is some of this they actually try to purge out whatever you have taken, and some of it increases your metabolism, and that can actually. I've seen patients who try to take weight loss products which are not prescribed or off the shelf from some bogus thing, and what happens is they actually get a lot of kidney disorders. A lot of them end up with ketosis. They come and they already have some kidney disorders, which is not all, which is not very good at all. So I always feel that when I always believe that there's a reason why they are fitness instructors, there's a reason why they're doctors, there's a reason why they are people who are in charge of weight loss. But you have to do something responsibly, and trust me, nothing comes easy. From a person who has gone from 140 kilos to 90 odd kilos, losing about 50 plus kilos in the space about, I would say, 4 to 5 years, I can say that nothing comes without hard work. You must have a balance between diet, regular exercise, and self-discipline. I believe these three things. You may or may not want to add it with prescribed and allowed supplements, but at the same time, you really need a lot of guidance from professional and experts. Try your best not to do anything by yourself or make moves by yourself, because you may actually end up hurting yourself. And a lot of them, especially in bulimia, which I will talk about a little bit later on, they overtly try to exercise and they actually end up injuring themselves. So
Doctor, add on to what you have said. I'm just going to try to echo that. Even it's actually a temptation. Losing weight fast, looking lean, looking toned, looking, watch more abs and so forth. But I think everything have to come with hard work.
yes,
Anything
correct.
that you want to do it on a shortcut, right? Putting up a pill and like a magic pill, you lose 5 kg or 7 kg. I think it is going to be putting a lot of stress on the kidneys as well, and also to your respiratory system, and not
Yeah,
forgetting the cardiovascular, because all these substances, because since it's a topic that we are talking about in anorexia and bulimia, which is eating disorders, but it also accelerates the heart rate to a enormous beats per minute, which probably of 150 or 160. Probably you had a stage 3 of blood pressure diagnosis, right? And what
no,
happens at that point of time is probably you're sitting in front of your computer table, and because of that pill, it has already elevated your heart rate. So you might be perspiring, you should be shivering. So I think all these weight loss products, especially weight loss product that is not diagnosed by doctors, please do not consume it. Please do
yeah,
not consume it unless it is been prescribed for certain medical issues, or it has been diagnosed, or it has been prescribed by doctors. If you take it, pretty much is healthy, because doctors not just spend 1 week or 2 weeks to get their certification. So I think they know best, and they have a lot of interest in the human, of course,
yes.
with people who are coming to them.
Actually, Vance, before you go forward, I think I realized what you're talking about. It's, I think a lot of people, they take unregistered supplements which has thyroxine or some diuretic inside, which
Yeah.
basically they start urinating a lot, but they don't lose body weight. They're actually losing water in their
Water.
body. So you find a lot of people who actually take this, and then when they go for it, they go for gym, they go and they exercise, and they drink a lot of water. You find that they've come back, and that's when they break their spirit, that they're saying, oh my god, I just went for exercise and this is what happened to me. So a lot of them end up taking products which has thyroxine inside, which actually exactly what you put it off, it increases the metabolism rate, but at the same time it increases the heart rate. Everything just goes haywire, and the person can become a bit I would say agitated. Some people call it a bit of psychosis, but
Yeah.
at the end of the day, it is all unauthorized prescriptions, which can actually lead to heart failure and even eventually, in some cases, death. So I would always recommend that use substances which are prescribed, and also look at it at what is the content. A lot of this, how do you know whether uh, whether the product is actually legal or not? Look and see what it is actually described. Most of these herbal products, they actually write herbal names, they don't write medication names, and you will find that some of the actual medications contained in this herbal product. So it is a way of people blinding the fact what the actual truth is. So it's actually quite dangerous, and I agree with you, Vance.
Doctor, because this is a very interesting topic, because a lot of people who want to embark on a fitness journey, or even if
Yep,
they want to fitter or healthier, because we're still talking the same context. But at the end of the day, I think this is a very a topic that everybody want to talk about, because everybody want to have a great aesthetic body. Who doesn't want to have it? But
agree.
in the expense of your health, by popping up some pill somebody recommending you, or
Mm.
something that you are taking in and losing 5 kg or 6 kg in a week, that is going to take a big toll for your health, especially your heart, your kidneys. And you got to think about that. Not just looking good is good, right? You
And,
got to think inside and outside as well.
yeah, and what people keep forgetting is, if you lose it very very fast, you can put it on back very very fast. So if you lose your weight very very fast, from experience, especially if you're taking something which has diuresis, where you actually urinate a lot, it's all water in the body, and when you drink, it's actually going to come back. So I always tell my patients who want to go for weight loss that there must be a certain plan. You must lose weight at a at a certain pace, and once you lose weight, there will be a point where it's stagnant. There's a couple of things which you do, and then you just bring it up a bit, and then you go down, and then you keep it, you keep losing it, but you need to know when to stop. and that is why the professional help is there. When you hit brick walls, sometimes actually not a brick wall, it is a big wall with a door. You just need the right key to open it, and that is where you find professionals who are actually holding the keys there.
Doctor, when you talk about diuretics, diuretics is a very interesting study as well.
Yeah.
It is prescribed by doctors, but of course, there's a reason why they prescribe it, because it's related to kidney. You got to take it out, your diuretics out. I mean, as much of your body
Kidney and the
wants.
heart. Yeah, that's
Exactly.
right.
But in under what circumstances, doctor? Because just a little before we dive into the topic, when will a doctor will prescribe a diuretics for what
Oh,
reason?
that's like asking, when will the doctor actually prescribe paracetamol? You can prescribe it for pain, you can prescribe it for fever, but of course, diuretics, there are multiple things. Some people give it for swelling, some people give it for urinary tract infection, some people give it for heart disorders like congestive cardiac failure. You get it, some people who want to jumpstart the kidneys and get them to pass urine again. But these are many things which you can use. Some people use that for hypertension, to reduce the hypertension of the blood vessels and even in the heart. But at the end of the day, you find that there is an indication, and sometimes they are only given for a very short period of time. Not everybody takes it chronically. Like there are some patients who you find that the moment you stop that medication, their blood pressure disorders become goes out of control, so they need to take it for a longer period of time. But to be very fair, even if they take it for a long period of time, you will actually have to monitor certain markers, like even their kidney function. You may need to monitor sometimes their liver function, depending on which you go. You may need to monitor their blood pressure, because some patients who are taking it for very long, suddenly their blood pressure becomes okay. They may need to halve the medication, or they may need to stop the medication. Or when you see that the kidney function is going out of control, or there's something wrong, you need to stop it immediately. That is why I always recommend patients, whenever they are on hypertension or diabetes medications, to actually see a doctor, because buying it off the counter, even if you have a prescription without the doctor seeing you for a stipulated period of time, may actually be doing harm than good. Always people think that, oh, if I take medications I will be okay, but there are also conditions where you actually need to halve the medications or stop the medications due to some reason or another. So I completely agree with you. It has to be done very carefully, but definitely under the prescription. Don't even go to the pharmacy hoping that this pharmacy will actually prescribe you something, because you actually need a professional to assess you holistically. A lot of times you find that when you go to certain places, or friends telling you, who are not doctors, who are telling you to do this and do that, it may work for them, but it definitely may not work for you. It is not a one quick fix for everything. So even in chronic diseases, diabetes, hypertension, we look at how bad the condition is, and then we move on to the medication. So I think trying to make everything as one fix is not the answer and solution to anything.
But I think there's also more to it, doctor, because I think it's more into temptation, and
Yes,
we keep talking about temptation again and again. Like you said, it's more like a OCD obsession, right? Uh,
obsession,
so
obsession.
it's become more like a very like I want to get results fast, and
Yeah,
there are few cases before, of course, not mentioning names, but people come to us and say that, hey, I want to get into a certain substances, I want to take certain steroids, I want to take certain weight loss. What is your recommended? My direct line is no, no, no. Even
yep,
if you take 5 years to lose the weight, please do so, because your internal organs are the most important thing, rather than looking aesthetically nice with these chemical substances. Because at the end of the day, you are not sure what's going to happen to you in the next 5 or 6 years time.
very
Because you don't have a doctor to prescribe all this, and you never should be prescribed as a weight loss substances. It's never
true.
been, but unfortunately, that's what some of the society are using it, and
Yes,
that actually lead to a lot of serious health problems as well, health issues as well.
I agree with you. I always tell my patients this: would you like to look lebih kurang you're okay, and then use lose your weight gradually, or would you like to take supplements which are not authorized, look very fit while you are sitting and getting your dialysis done? So I think it is the bigger picture here. A lot of them want to look great, but it is not going to be about looking great when you're sitting down having your dialysis done. No disrespect to dialysis patients, of course. But I think if it's something which is avoidable, something which you can anticipate, why take the risk? So I always believe that if there's a better way of actually than taking supplementation which may harm yourself, why not try the conventional method? Because again, a lot of people even think that even if you take a prescribed supplementation for weight loss or whatever, at the end of the day, you still need exercise, you still need to eat right, you still need to monitor your food. So why abuse these supplements when you know that you can't do the rest? It is not a quick fix situation. Trust me, it requires a lot of hard work, dedication, discipline. And unfortunately, uh, we are living in a society which wants a quick fix for everything. And unfortunately, this doesn't work that way. And when somebody offers them for a quick fix, there is a very high affinity towards it, because everybody thinks that, oh, okay, you know what, I'm going to go to this guy because this guy is going to help me do everything fast. But they don't realize that they're not only doing themselves harm physically, but also maybe even mentally and metabolically.
I'm sure, especially they can abuse the system. So as we are moving on to the slide, I mean, thanks for all the questions that's coming in. I mean, we have almost about 5, 7 to 8 questions that's coming up. Thank you so much. We will answer them, but I think all are related to eating disorders. People are asking more on does family. I mean, it's more on holistically as well. I can see more questions that's coming up. So let's get the slide rolling on, Doctor. So we are now at bulimia nervosa.
No, anorexia nervosa,
Okay.
basically there's low calorie intake, but the biggest thing is that they're underweight. So basically they look something like that. So they are actually very, very thin, but when they look at themselves, they always feel that they're overweight. But when you measure their weight, height, BMI, I mean, when you look at their BMI or their body build, they're actually very, very underweight, and they're very cachectic. They're actually all, sorry to say, they're actually just bones and skin. But they still view themselves as fat people. So that is and that is why, as you have rightly put it, Vance, we actually think that is a mental disorder already. So bulimia nervosa is the next thing. This is slightly different. The calorie intake is high, but the body condition may be normal or abnormal. They may be fat or they may be thin. Sorry, they may be normal or they may be very, very fat. But the only thing is that they eat, and after they eat, there is a purgative effect. So when you were saying that they purge like they vomit, right? But actually, there are a few things. They either purge by vomiting, or they induce diarrhea. Or what they do is, after eating really a lot, they get so guilty, they start doing overt exercise. That means they just exercise to the max. They want to burn out whatever they have taken. Basically, is getting rid of whatever you have eaten. Um, and this happens on a very, very regular basis. And that is why it is considered as eating disorder. The biggest issue here is bulimia nervosa. A lot of people get confused between bulimia nervosa and binge eating disorders. So bulimia nervosa actually is when you eat and then you purge and then you try to maintain your shape. All right. Binge eating disorders, even though the calorie intake is high, normally these patients or these people are overweight, because what happens is they just eat and 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 eat without control, and they just lose control of themselves while they eat. And it's I know some people do lose themselves while eating, but this happens on a regular basis, and they can really, really eat. Sometimes, if you look back, actually, when you look at movies, especially Bollywood, Hollywood movies, when people are upset and they tend to eat a lot, you can actually say that that may be binge eating disorders. And sometimes they actually go for very, very high calorie food, sweet stuff, high carbohydrates. So that is actually what happens. But we live in a world where everything is different. You may have anorexia nervosa, where the calorie intake is very, very low, but they may be normal weight. But they cannot be classified as anorexia, because they may be normal weight, but they are actually having low calorie intake. And that is why they have come up with something called ethnos or OSFAT. Eating disorders not otherwise specified, or other specified feeding or eating disorders. So it's mixture of symptoms of 3 and above, which is something which it may be bulimia, but their calorie intake may be just normal. There may be abnormal. There may be some purgative. So again, it becomes under OSFAT. So these are the 3 major eating disorders which we normally see. So what is the prevalence of eating disorders? Actually, if you look at Europe, Malaysia, and when I say Malaysia, I would also say Singapore, worldwide and in teenagers. So anorexia nervosa, it's about 3.6% is the highest. And binge eating disorders is about 2.3%. BED, bulimia nervosa is 2.3. binge eating disorders is 0.7. Most of the time you will find that everybody says that there's more in the females than in males because thinness and figures, and males normally look at musculature. But after looking at it quite deeply, I also feel that even doctors may actually underdiagnose males with eating disorders is because a lot of the questionnaires where they're actually building up, it's actually made more for the females, like uh, do you have a desire to be thin? I don't think males, generally speaking, want to be thin. They want to be muscular. They want to look macho. So uh, the way fit or perceived or a thinness or a low BMI is perceived in these two sexes are different. So when you keep asking a male whether they have a desire to be thin, they may not say yes. They may say no. I don't want to be thin. I want to look muscular. I want to look fit. I want to look tough. But the females said, yeah, then yeah, I'll go for that. That sort of thing. So I think it is the way the questionnaires are designed. So that is why you actually need how shall I put it, a clinical diagnosis where you have a clinical interview. There's a multiple more load of investigations to be done before you can actually come to that. So in Malaysia, basically, they feel that, and when I say Malaysia, I also mean Singapore. They feel that there's no difference in males and females, but actually the sample sizes of the studies are very, very small. But if you look at it worldwide, you actually look at anorexia nervosa is 0.4% in females. Bulimia nervosa is 10 females to 1 male. And again, anorexia nervosa and bulimia nervosa in females is associated with menstrual irregularities, amenorrhea, athlete's triad, where they have osteoporosis. But yes, at the end of the day, it will disturb their bodily function, especially their menstruation. And why can anorexia nervosa actually be very, very fatal, or even bulimia nervosa, where they actually throw up a lot, is because they get electrolyte imbalance. And like what you were exactly pointing out, Vance, if they are taking some supplements like diuretics, which also throws up more and more electrolytes, they get electrolyte imbalance, and sometimes they can actually get into very serious medical conditions, and they can even die from that. But what is interesting is teenagers. When you look at teenagers, 0.4%, again, anorexia in females, again, 10 to 1 females to males. Binge eating disorders, they always feel is higher in males, but again, it's because of the way the questions are framed. Maybe do you eat, need, and need, and eat? So it becomes something which is relevant to both sexes. But I think the way perception has made how the male should look like and how the female should look like by society has actually caused a lot of this to become very difficult to just be diagnosed offhand. So of course, a lot of people say that, hey, eating disorders only happen in normal people. They don't happen in other fit people. No, it can happen in athletes as well. As you can see, a lot of females again diagnosed more than males, which is a very big misnomer here. And of course, eating disorders can causing electrolyte imbalances, prolonged injuries. Remember that a lot of them, when they actually have a bulimia nervosa, when they actually want to purge out, they end up going and exercising, and they don't do the proper warm up. They don't have proper stretching, and what happens is they get tendo Achilles rupture. They get so many other issues, especially related to musculoskeletal injuries. Because of that, they get painful knees, they get painful joints because of overtly exercising without proper warm-up. Especially endocrine, cardiovascular, reproductive, central nervous system, gastrointestinal, and renal maladaptation. Taking a lot of diuretics until there's no more body, there's not much water left in the body to actually secrete, can actually cause some renal disorders and renal shutdown. So, of course, some people.
Just holding you here for a while. So so when things are getting not from the shelves, not from the doctor's advice, of course, it's definitely a no. But unfortunately, there are some so-called chemists. They themselves became a chemist, and then they try to take it a certain mg or certain milliliters or whatever, and they try to do it for their body. Isn't a big risk that someone is taking in a matter of life and death?
It's a huge risk, because I've got a lot of patients who have come in who don't even know that they have renal disorders, and they're actually on some supplementation, which is something which has been given to them by their ancestors. It's a family tradition to take these particular supplements, and everybody in the family ends up having some kidney disorders, but nobody actually links it to that supplement because they, oh, it's a traditional medication. How can it be dangerous? So I think any medications. In fact, I remember. Couple of weeks ago, you had Dr. Praveen on air, and he was talking about medication, and he said medications are actually poisons. Don't get me wrong, medications are considered something which can bring harm. It can bring good, but it can also bring harm if it is not taken in the correct doses. So I would like to state that in this particular point, that when if you take these medications not in the correct doses, it may be harmful. You may be getting the exact same substance, but because they're actually prescribed in much higher amounts, you will actually bring more harm to yourself than anything good. So if I were to give a diuretic to a person instead of 20 milligrams, and that person actually ends up taking something which is about 60, 70, 100 milligrams, which is way more than their body weight, at the end of the day, you will find that it is much more harmful to them. So that is why you have to be very careful when you're actually taking any sort of supplements. I always tell my patients, whatever it is, whoever it is, whenever I said, okay, you're taking medications, please bring along your medications, including the supplements or unprescribed medications which you're. Some of them get scared. Hey, why is this guy going to scold me? No, it's actually information I can actually see and say, hey, you know what? And there's some common medications which certain races take, certain people take, which I always tell them, hey, look, in these particular medications, it has been shown that when we take it to the lab, most of the time they are very high content of steroids. Let me just share with you. I've actually got one patient who came and full of acne, pimples, and she was telling me, I have a lot of these pimples and I need to get. I said, okay, no problem, we'll help you get rid of it. And it was going along, and as when you mentioned, it was actually a bit slow, and she got a bit impatient. So somebody told her, hey, you know what, this Ubat Kampung is a village medication you can take. It actually helps. I said, okay, fine. She said, let's take it. She didn't tell me about it. She just took, and then suddenly her skin complexion all became very nice. And when she came and saw me, she never told me. And I said, okay, we'll just continue your medication. Of course, I tapered down the medication, as I told you. When the patient becomes better, of course, we would like to reduce the medications. And she kept taking, and then suddenly she stopped the medication from the kampong. She's from the village. She said, I'm not taking that anymore. And suddenly there was a breakout of pimples. And she went along, and then somebody told her, you see, the reason why you're getting this breakout is because you stopped the medications from the village medications. Continue that. She continued to take that. And finding that it was actually helping her, she stopped coming to see me. One day, suddenly, she came to see me where she actually had a small swelling on the back. And I said, oh my God, what happened to you? And then she said, oh no, I've been taking this kampong medication, which she finally showed me. And I sent a sample to the lab. That one cup of medication contained about nearly 20 tablets of steroids in that one small dose of medication. Can you imagine? She was taking it by the bottles. So I told her, I said, girl, you're having steroid toxicity, and that's why she was having that buffalo hump. Her periods all became disordered. Her face became puffed up, but she had no pimples. So again, at the end of the day, you will not have pimples, but you will have other disorders which may actually be even much more worse. And when I checked her kidney had taken some effect on it. And I think when she stopped, we managed to reverse it, but there was still some amount of kidney damage. So at the end of the day, when you're looking back and you ask her, was it worth it? She said, no, it is not at all. Might as well be patient, get the problem sorted at the base root, and do it effectively and safely, rather than jump the gun and at the end of the day indulge in something which is you're going to suffer for lifelong. That's why I said you can look good and sit in the dialysis center because of kidney disorders, because of whatever you have taken, or you can look reasonably okay, be patient, reach that same level with good hard work, and maintain it in a better rate.
Doctor, this topic, I think we can go for hours and hours and hours because there's no full stop to it, but it's more
Yep.
on commas and it's more on question marks. And we
Yep.
also, along the same line, because that will be the question before we finish up with the slides, and then we try to answer all these questions. Thank you so much. A lot of people are commenting. Thank you so much. Please do share the video as well so that more of your friends and loved ones can join us. We often hear these words say zero carbo, low carbo, don't take at all, carbo is bad, carbohydrate is bad. Because I remember very clearly, a couple of weeks back, I had a talk session with endocrinologist Dr. Shalina. Shalina
Right.
said the same stuff, right? Everything have to be in a moderation. But
Yep.
nowadays, a lot of people who want to lose weight, the first thing they come is zero carbo, no carbo at all. But it's not true at all. If you taken it under moderation and under the guidance of endocrinologists or nutritionists, to be very specific, I think they're perfectly fine. You should have carbohydrates. So where does this no carbo or zero carbo will lead to weight loss? When this statement that came in and people are believing in too much on that. What is your take on that, doctor?
I believe that okay, this is my theory. Carbohydrates are actually the building blocks of your body. All right, it helps. The problem is when you actually look at the breakdown of carbohydrates, which actually links to sugar. So that is where the weight loss happens. A lot of people they get confused because of the term fat. When you call a person fat, that means they think, oh, lamb has fat, beef has fat, chicken has fat. So if I eat the more of chicken, I eat more of lamb, I eat more of beef, with the fat, I'm going to become fat. You know, there's a very big misnomer there. I think a lot of people have come to the point of realizing where sugars are actually, is what we need to control. A lot of people go on carbos, low carbos or no carbos. But I always tell my patients there is no such thing as no carbos. You have to have low carbos because at the end of the day, when you have, if you don't have carbohydrates, you won't have enough for your body to actually utilize. You remember, you need energy still to breathe. You need energy to move. You need energy to talk. You need energy to think. If you don't have all of this, how are you going to do that? So you cannot achieve zero carbos because let me tell you, if let's say you take let's say you take a piece of chicken, all right, do you think there are no carbos there? There will be carbos, there will be definitely carbos, but of course, uh, if you eat rice excessively or you eat rice containing products excessively, yes, then it becomes very dangerous. But of course, if you eat it in moderation, that is why it is important to get a nutritionist on board who actually tells you, okay, this based on your body weight, how much you tend to lose, this is how much of rice you should be taking so that your body doesn't undergo starvation. And it's very funny, a lot of people, keto diets may be okay to a certain point, but at the end of the day, I think it is people who overdo it. I remember a couple of years ago reading about a famous footballer in the UK who has come on openly and mentioned that he had an eating disorder where he went overboard. You're familiar with Roy Keane, Vance,
Mm-hmm,
the
mm-hmm.
former Manchester United captain?
Yep.
Yeah, so he openly came out and he said that I read his book, and he said that he went a few of the players decided to go on this diet, and he went overboard. He really went overboard because he really wanted to lose a lot of weight until it affected his hip, where he said that when the doctor was doing the operation, and I can actually I still remember it because I could just picture it as he's saying it, that as they were shaving off his cartilage to make sure that the impingement becomes less, it was just peeling off as if it was brittle rubber. So can you imagine brittle rubber where you just do this, you just flick it and it breaks into pieces? That was actually what his hip was inside. So I think at the end of the day, you can't go no carbo. You can go low carbo or moderate carbo, but you can't go no carbo because no carbo is definite KO.
But
That's what
but
I.
uh, but having said that statement, can someone just prescribe it, right? I mean, you should see a nutritionist
Oh
or you should
yes,
see a doctor,
yes,
endocrinologist, because I believe these are the three people who are even doctors, right? The
right.
professionals do your basic HB1AC. They
HB1.
identify your blood rhythm or rather your patterns and the contents, and then they said, okay, probably you need to change your good eating habits but
Yep.
never been on a zero carbo, because when you go on a zero carbo, where do you get your energy? You get your proteins, you get your minerals, but where do you get your basic energy? So I
I
mean, a
don't
lot
understand.
of consumption
I don't.
again.
Yeah, I don't understand how people can go on zero carbos, because even if you take a piece of mango, there is carbos there. So I think the only way you can go on no carbo is if you drink plain water and that's it lah. You don't do anything else. There's no way a person can go on no carbo. I think they have to really watch their carbohydrates, in the sense that, of course, under prescription, strict prescription, and of course with the help of the nutritionist and endocrinologist, that you actually have to count your calories. I think that at the end of the day, that's what actually matters. Where you really count your calories, you put your input, and you can't go no carbo, no protein. Even if you eat a piece of chicken, there is carbos there. You can't say that there are no carbos. I think it is limiting the number of carbohydrates which you actually consume, especially complex carbohydrates. Very, very complex carbohydrates like rice and starch. That is what can actually cause you to put on weight. But there's no way in the world I foresee anybody going on a long term with no carbo. There's no way. I don't think a person can actually survive with no carbo. I always tell my patients, you want to do weight loss, can we go on a low to moderate carbo? No carbo is no go for me.
Actually, doctor, it's very interesting because going into different dimension, different
Yeah.
divisions, because we have a lot of questions that lined up. So looking at
Yep.
the question, I think we might go for another 1 hour. So probably we want to quickly finish up the
We will
slides.
finish up the slides very quickly.
Yeah, and we try to take up the questions.
Yeah, so basically a lot of people think, Vance, I would just like to say, a lot of people say that athletes don't have weight disorders, right? Or weight or eating disorders. Imagine gymnasts, imagine figure skating guys, imagine gymnastics, bodybuilding, sumo fighters. I remember Malik Noor when he wanted to go for sumo fighting many years ago, and he actually gave an interview and he said, the amount of food he had to eat. He said it is basically, thinking about it today, it is like binge eating disorder. He said, I had to eat large amounts of food just to maintain the weight to go. And because you need to maintain a certain weight, even in boxing, where they have to have featherweight or lightweight or even heavyweight, they have to maintain a certain weight. And that also actually leads to eating disorders. So, of course, it leads to a lot of other medical conditions and injuries. And in athletes in Malaysia and Singapore, there has not been much research done about this. But as you can see, even in Paralympic athletes in Malaysia, it is reported that 30% of them had about symptoms of binge eating and overtly diet. So it is a common problem. So these are some of the positives, and I'm near towards the end of the slides. Basically, gender and age. Some genders are more prone, but again, I don't believe so. I believe they're all the same. Age, maybe there may be some. As you're younger, you may want to look built. As you're older, you may want to look thinner. So there may be some social demographic data there. Athlete, especially with athletics competition levels, health status. A lot of people having diabetes, when they're very thin, they want to look big again. I've got patients who come to me and say, Doc, I've lost a lot of weight since I'm a diabetic. I want to put on weight. So there are a lot of other things that leads to eating disorders. Environment, and this is exactly what we have been harping about, Vance, lack of supervision. Culture, gender related, girls, oh, you must look good, you must eat less than the boys, that sort of thing. Addiction factors, alcohol, smoking, drugs, which you should never do. Family history, depression, anxiety, and stress can all cause eating disorders. Some protective factors, positive thinking, person oriented or positive and person oriented coaching styles, social influence and support from teammates in healthy attitudes, coaches who emphasize factors that contribute to personal success, and coaches or parents who educate, talk about, and support the changing. And again, this is female body. I think it is of all bodies, right? The consequences of eating disorders, purgative behaviors can lead to potentially life-threatening issues, potentially affect major organ systems, which can lead to bone mineral density. A lot of people forget that osteoporosis actually happens. One of it is because of eating disorders, menstrual disorders, and some problems resulting from anorexia nervosa can be reversed, like bone mineral density, but it has to be actually done as soon as possible, because if not, it can become permanent and irreversible. So why eating disorders are important? Of course, there's a 70%, all of this which were mentioned, of course, 70% of them are the recovery rate, but if they come in early. I just like to end with this slide. A lot of people think that, hey, you know what, eating disorders, how do I picture eating disorders? Lady Gaga and even Paula Abdul had anorexia. Admittedly, they have anorexia nervosa. Russell Crowe, Lady Diana, and Elton John all had bulimia nervosa. They eat and they purge out. Binge eating disorders. Sorry, ladies. Elvis Presley, even more so Rishi Kapoor. You know how he was when he was young? This was his picture. Can you see that? Most of the people in the Kapoor family actually have a binge eating disorder. So can you imagine Ranbir Kapoor, who is very, very young and good looking? Unfortunately for his family history, I hope it doesn't happen to him. Where the Kapoors admittedly have a binge eating disorder, and if they're not careful, if Ranbir is not careful, he may actually end up like all his uncles in putting on a lot of weight. These are some of my references. Thank you.
Thank you, doctor. Thank you so much for the topics on binge eating, anorexia, and also bulimia. I mean, these are all conditions that to do with the mental, psychological, and of course, if you do have this kind of symptom, please do seek help as well, and not to be suffered in silences. I mean, of course, if you have a loved one, please share with them, and do make the right choices by attending it and attending. I mean, seeking a professional's help,
Seeking help.
especially,
Yep.
and
Yep.
then from there,
Professional help.
movie up. And of course, we talked about a lot of stuff on carbohydrates, chemicals, steroids, and of course, this topic can keep on going, and there's no stoppages for that. But I also want to share this because this happened just about a month back. Of course, no names mentioned. So I do came to know that a particular person is training, and then the particular person has developed a very great physical, aesthetic body. And then when we went a little bit more deeper, and then we found out that this particular person is taking full of steroids and taking full of substances like diuretics, clenbuterol, and sustano. And these certain drugs, especially steroids, I want to mention here that these certain drugs, especially like sustano and so on and so forth, are actually prescribed to people with cancer or even AIDS, actually, or even certain as muscular dystrophy, because it's trying to lose a lot of muscle and they need to quickly put on. But if it's a normal person who takes these kind of drugs, I think there's going to be a very, very huge impact happening to their health. And especially for people out there who want to start exercising, please never, ever, ever go into quick fix, because quick fix will never get you into a healthy, holistic approach. You'll never get there. Of course, you will have a fantastic aesthetic body, but it's so much of temptation, because depending with the hard work versus a quick peel or quick substances, of course they bring you miles or bring you to different dimension. But at the end of the day, you got to ask yourself, is it really that I want in a golden age? Do you want to be in a great health, or rather you want to be in a poor health? So
Yeah.
without a doctor's prescription, we should never ever take any substances without the doctor's prescription. If
Vance,
we
yeah, sorry. Vance, I actually have a diploma in football medicine, so I see a lot of sports cases as well. I find a lot of gym instructors who come who want to look buff and they want to pump iron and they want to take certain steroids, which I don't actually honestly recommend. The reason is this: I'm not going to mention any names, but if you look at the movies, especially towards movies from India, you will find that there are certain people who have been pumping iron for very, very long times. Even as they age, their muscles don't drop. Their muscles mass remain. They still can pump iron. I forgot the guy's name who just recently died, Jack something. He is 90 years old from US, and he has been pumping iron since since I was a young boy. He was about 60 already, and he keeps pumping iron, and he died at about 90 something. So uh, with hard work it is possible. How do you know whether a person is actually on steroids? If you look at certain movies where certain actors don't actually wear shirts, when they were very young, they with all the steroid jabbings, they were okay. As they age, everything goes haywire. And as they age, you will find a lot of things. A lot of people don't realize that as they take more and more steroids, they end up with balding, they end up with cardiovascular disorders. I've seen 40 years old guys, fit guys. I mean, fit means you put them on a treadmill, the treadmill is probably going to break before they do. But you know what? They already have cardiovascular diseases, heart attacks because of overtly trying to take steroids, unprescribed steroids.
So again, doctor, we got to. I mean, for viewers, make sure if you know anyone, loved ones, please do encourage them. Do not take something that is not prescribed by nutritionists, endocrinologists, or even doctors, because these are the guys who spend many years and still probably still studying right now. And as in the medical field, it's always a breakthrough. It's every day is a new journey. Everything is discovering in exploration as well. So please do not take any of those substances without any doctors or nutritionists or even the endocrinologist advisors. Right. So, doctor, we're going to go to the questions, and then probably we will then end our show within the next 15 minutes. So the most interesting topic that we are getting right now is we have from okay, we're going to take this from Deepam itself. Said, Dr. Arvinder, if a person comes out of an anorexia condition during his or her teenage age, can it reoccur again? So, question is it possible that he can come back again after 10 years or 20 years?
I would say yes, because eating disorder is a mental related disorder. There can be relapses. I think it is more important to teach a person how to recognize that it is happening again, and so that they don't come in as late as they did the first time. Self recognition, sometimes they may be far from professional help. They know when to seek for help, they know when it is getting worse. There will be certain indicators and markers. You find that old habits are coming back, old situations are coming back. Of course, we monitor, we always tell them, okay, you have to actually put your weight between this and that, that sort of thing. And that I would never say that there's nothing which can have a relapse. There can be anything with relapse. Any mental disorders or psychiatric disorders can have a relapse. There is a risk of it. But to be able to recognize it, to be very fair, some of the Kapoors, they recognized that they had a binge eating disorder. They rectified it, but some of them actually had a relapse, unfortunately. Not all, some of them. So yeah, it happens to any eating disorder, I would feel.
So, yes, Deepam. So, for your questions, can happen, right? At any point of time, it can relapse again. So, we have Jim Lai say that does family or relatives that encourage eating disorders considered an abuse?
That's a tough one. Abuse in the sense that if you keep telling a person to eat when the person doesn't want to, that's force feeding, I would say. um I'm sure, Vance, you would see a lot of parents trying to force feed their kid. I want a kid who really chubby kid. I want to hold that fella like a teddy bear. And then you realize the next thing that he's 15 or she's 15, can't seem to lose weight. I think we have to move on away from this. We have to look at having eating disorders from force feeding is actually quite bad. I think we have to come away from that. We have to actually educate people, and we have to educate parents especially. It's difficult. Parents, grandparents love feeding their kids or grandkids, saying that they want that chubby. It's I always tell people, the best way to judge whether that person is in shape or not is if you look at the pet. If the pet is actually very, very, very large, you know that this person may be overfeeding, because that person will think, hey, you know what, the pet is eating as much as what I think he should be eating. So I think, unfortunately, when you force feed people and they develop that satiety, that appetite for it, sooner or later it'll be very difficult for them to stop. So I think, yeah, looking at it, it is not an abuse, but I think it is being very unfair to that person.
It's more love, love about
Yeah.
eating everything. And of course, sometimes, as parents, there's always concern and love. But there's always a certain amount of food that you want to, instead of one plate, you put two plate, three plates, then probably he will have certain
Yes.
issues as he grows up, because he's been taught and been forced with love. So that actually leads to a lot of issues as well. Yes, Jim Lai, thank you for that.
I
I
remember
want
a comedian once saying that, when you go to your parents' house as Indians, you go to your parents' house and you don't eat enough, right? They'll say, "What the hell are you doing? What's wrong with you?" Even though you try to tell them that I've cut rice, some of them say that, it's easier for me to tell my parents that I've lost my job than they say that I'm cutting down rice. So,
yes.
I think mentality, culturally linked, mental links to it has a lot of issues with it.
And also as an Indian, because we go to different families during festive season or non-festive season, or even relatives or business associates. I remember when I went to India with one of my aunties for business associates meeting. I do not know why I was there, but I was invited, and she told me before I go. Right, she said, "Whatever they give you, just eat." I'm like,
Yep.
and then and then you should see how they serve their hospitality is perfect. I gotta just say
Fantastic.
it's
Fantastic.
amazing
Yeah,
because
yeah.
the drinks I got six drinks on my table: water, rasam, mango juice, lassi, coffee, tea, chai. So everything I was like, oh, am I going to drink all that? So that is our culture, right? We giving people the right amount of stuff, but actually sometimes it can be too much, doctor. Right. Okay,
Yeah.
taking up the next question. That's what Monisha has asked. How to maintain healthy eating and include it as a routine. I would like to take that for Monisha. I think
Yep.
this is one of the challenging, all right, for a lot of people, working adults or students. I think across anybody, the kind of life that we live in this very stressful environment. Everybody have to fend for themselves, have to quick, have to move. Everything is about fast. With that, a lot of fast food that comes in, and people want quick and cheap and good and tasty. So everything have to be manufactured. So we're not going to go into the names of these places, but to have a healthy routine, I think it got to start from enjoying the food. Right, do not go into extreme cases. If you want to have a certain body type for certain food, I think the best person is nutritionist, because they spend quite a significant number of hours to become a nutritionist. It's not just a title. They will be the best person, because if you see them, then they probably will break down every single thing. They'll be looking at the nutrients, the micros, the macros. They even look at the calories, the content. They even look at RDI, recommended daily intake, or RDA, recommended daily allowances. And these are the pros. When the pros say something, you got to listen. And also the amount of vegetables, the fibers, they can keep on talking, and they are very wonderful people, because they are always with colorful factors, grapes, tomatoes, and kind of stuff. But unfortunately, in this current era of what we are living, we are probably not eating healthy,
Yep.
because we are
Very
always
true.
on the go. And even if you look at it, doctor, I mean, even if someone goes for lunchtime, the salad can actually cost more expensive, or rather a little bit more than
Very
those
true.
stuffs, right? So it's
I
a bit
always tell
tempting,
people.
right?
I always tell people, eating healthy these days is actually more expensive than eating less healthy, because unfortunately, it is looked on as a business. A lot of people take advantage of them. Some people who refuse to eat carbohydrates, they take more of meats, or they take more of vegetables. It works out actually much more expensive for them. I've gone to shops where, after me losing a lot of weight, you want to maintain it, you go to a certain shop and you say, okay, you know what, I just want this, and they will say, tamo nasi ka? Tamo nasi means no rice. I say, yes, no rice. And then suddenly it's like a mental block for them, like, oh my god, how am I going to calculate, especially if you're going to the mixed rice shop, where there's no rice. You see, it's mixed rice, that means there must be rice. But if you don't take the rice and take other stuff, they'll be like, oh my god, how do I charge this fella? And then you'll call another guy, and then call another guy, then all of them will whip out calculators and they start calculating, and then they come up with an enormous figure. And then you'll be thinking like, oh my god, I should have just eaten unhealthily, I would have paid much less. But unfortunately, that is how we have built it. And that is why I honestly feel that this is where government intervention is actually important. I think the government should come up with plans, especially meal plans calculated with calories. I have seen a lot of a chain outlet these days who come with calorie intakes. But I think it should come to the point whereby government intervention is important. Unhealthy things give more tax. In Malaysia we had a sugar tax lately, which was done I think about a year ago, because we actually found that a lot of people were actually drinking a lot of aerated drinks, a lot of gaseous drinks, and then we found that one of the ways they found in an overseas was actually to raise the tax. And I don't know how far it will actually reduce. I would like to think so, and I honestly feel that knowing that some of my patients, they prefer to take something healthier, they prefer to take water than to buy drinks. But then again, I think there must be an encouragement rather than a punitive effect. I think people should be encouraged to eat. And can you imagine, if you eat healthier you actually pay much less? I'm very sure a lot of people will start doing it.
The reason behind that is because of, I think, if someone works at 8 to 5, but nowadays more on virtual right now, or home, stay home, from office. But what exactly happens that when someone, let's not talk about breakfast. Someone works under like 5 hours, and then they go for lunch at 2, which is a very stressful day. The weather is hot, humidity is about 37%, temperature is about 37 or 38, whatever, right? And then they had a very stressful day at office. And if I put a bowl of young tofu and the mama mee goreng, right? The Indian Muslim mee goreng, the Indian mee goreng, right? What will you go for? But it's a very stressful day for you, you are just like literally like done or killing somebody, or you just like strangle somebody. But at that point of time, I put a young tofu and a mee goreng in front of you. What will you go for? Be honest.
For me personally, I'll go for the mee goreng, because I look at the calorie count. But the problem is, I will know. I think out of 9 out of 10 people who I know will actually go for the young tofu and the second helping as well.
Actually, not
Uh,
true. No. I
yeah,
got to say that because I always ask these questions who starts training with me, because they want something quick, and their calorie deficit is so much because probably they are already at a half day. All they want is something to indulge themselves. So probably that's where the dopamine, serotonin, oxytocin, and endorphins kicks in. And at that point of time, they want luxury food. And add on to that, if I give you a mineral water and then some high sucrose drink, let's not mention names, sucrose drink, what will you go for? Gassy sucrose drink?
I,
Probably
I,
you
I
go
will
for
I will go for water, actually, to be very
okay,
honest. But
you go for the water. But that is a
sorry, I
society.
misunderstood your earlier question. I thought you were mentioning that tofu fa or is young tofu. Young
Yeah,
tofu actually is much more healthier intake compared to the mee goreng. So yeah, but I think at the end of the day, a lot of people will go for that fast because they get the kick out of it. Because remember, when there's a sugar rush, you feel that very nice effect. But unfortunately, when it goes down, that's where your mood goes down as well. And that is where you find that a lot of diabetics who are actually starting to control their sugars from very high going to low, they actually have that feel good effect, which actually gets lost. But you must actually tell them that no, it's okay to have that, and don't worry, it will go back to normal. But unfortunately, after a hard days of work, hard day at work, and a lot of people who are probably glucose deprived, they want to have that glucose rush, and it causes, and exactly what you say, it causes some release of endorphins. That is why if you look at comfort food, they call it comfort food, a lot of it involves a lot of chocolates and ice cream. It's comfort food because there's a glucose rush to it. We can't deny that fact, and the body responds to it that way. But I think on the long term, that's a short term effect, but the long term effect is much more devastating. I would rather
so
see
looking at
that.
that, I
Yeah,
think looking at this situation, I think every one of us has a psychological issue, somehow or
yep.
other, less or more. It's just a matter of that, because we all have the temptation. We all have that, the cravings. We all human beings after all. But of course, putting our health in the front, we always have to be very careful on the choices that we make. Sometimes we don't. We
Yep.
let indulgence to take place, but I think it's perfectly fine. But if you have certain medical condition, especially diabetes and certain other medical condition like blood pressure and kind of stuff, you got to be very careful with. These are indication markers, so you do not want to go overboard with that.
Discipline, that is the most important, because you know why a lot of people say today cheat day, but you know what, every time you're with them is a cheat day. So I don't know who they're trying to cheat at the end. I think they're cheating themselves. So unfortunately, that you know, I've read something about prebiotics. Have you heard of prebiotics, Vance?
What is that, doctor? Sorry.
Prebiotics.
Okay.
Okay, so a lot of people, what they actually do is, there's a system within the body whereby there is a prebiotics and probiotics. There is actually a thing whereby there's a theory. It's a theory. It's not a proven fact, but it's a theory that if you actually do not take sweet drinks, sugar, and all, where you're actually controlling your body weight, and then you have a cheat day. You have a cheat day. Now, this is a real cheat day. It's not every day. Huh? You have a real cheat day. You decide to take it, and the next day you'll be craving for it, because it seems there's a theory that the organisms within that particular one who actually indulges in this sugar sends out a chemical response to the brain, wanting the brain to consume more sugar. So that is what happens. So that is why, if you find that, okay, let's say if you're on a vegetarian diet for a very long time, suddenly you decide to eat meat, the next day you may have craving for it, that sort of thing in sugar form. So a lot of people, when they have very long days where they feel they're okay, I don't have sugar, I'm fine, I'm cool. But then that one day where they accidentally eat something, or they cheat day and they decide to eat something, the next day the craving is still there. I want the chocolate, I want this, I want that. And that is when you actually get the tip over. So that is why at the end of the day, Vance, exactly like what you point out, is discipline. You know when to call it quits, and that's it. So I think that's more important.
Thank you, Doctor. Because we have more questions coming up, we try to take them off. But of course, Monisha, as we what Doctor and myself has shared, I think that's very important. But do not do any strict diets, right? Because eventually, if you want to go on a diet, I think the best person to listen is not anyone except nutritionists or doctors or endocrinologists. The reason why am I saying that is because even I'm in the fitness industry for the more than 20 years. I do not put anyone on a diet. The basic reason is because there are certain minerals they might need. They need to do a blood test. They need to do their HB1AC. There's so much of things that talk about inside, not just coming in and say go on a zero carbs, go and high proteins. These may work for some people, but it may never work for everybody. So the best person is a nutritionist, and that is what doctor probably will recommend as well, to see a nutritionist, and they are the best person to sit down and go through with you on a very nice plan ahead for you, on a schedule. What are the things that you can eat, so you're not depriving from anything, because anything that you deprive, or no sugar, no this, no that, eventually it will turn up tenfold of your cravings. So instead of you taking one chocolate, probably you will finish one whole bar of it. Instead of finishing up one small bowl, you will finish up the whole tub of ice cream. Because that is what the craving does. So if you go on a drastic diet, it's going to create you a lot of issues. So
And that
always get a nutritionist.
and that becomes binge eating, because you actually end up eating a lot one time. So, to add on to what you have said, Vince, I think it is a team effort between the doctors and also the nutritionists and the endocrinologists. Everybody has their own opinion. They lump everything together. They find out what is best for the patient. But the problem is, what is best for this patient may not be the best for this patient as well, because of the way they, like, for example, Vince, if I'm going to prescribe, if I ever need to prescribe something for you, you being in the fitness occupation, I would maybe ask you to eat a different diet from somebody else who is not in the fitness occupation. A person who's having a sedentary job may have a different diet which they need at the end of the day, compared to an athlete or a person who's training very hard. So yeah, I think it is a team effort, and it is not. A lot of people just call up and say, hey, what do I do? It's not a one fixed thing. It depends on your lifestyle. You may be exercising only on Monday, Wednesday, Friday, so your diets will definitely be different from Tuesday, Thursday, and Saturday. That sort of thing.
And often we also hear in the fitness industry that someone puts somebody in a chicken breast, check broccolis, take chickpeas. It's not just about that. There are more varieties for food. So a nutritionist will go through with you if you're vegetarian and non-veg, so that they
Exactly.
plan for you a well balanced food
Diet.
plan.
Yep.
Never a diet plan, but it's basically a smooth, nice food plan, and that's what you should go. So we hope that has answered you, Monisha.
And
Yes, doctor,
different
you got.
and different meals every day. And different
Yeah,
meals every day, because a lot of them, they end up going on the same thing over and over again, and they become bored of it.
definitely. Doctor, we have Rina. So Rina has asked us a couple of questions, but I think I'm going to pull one of that. Rina, so she asked, is it okay to take a sugar-free drink instead? What is your opinion on intermittent fasting? And how effective are calorie deficit? So it's more like a nutritionist topic. Thank you for all the questions. We will be pleasure to answer that. Maybe shall we go into the sugar free one, doctor?
Uh, okay. It depends on whether a person is actually diabetic or not. If you tell a person who is diabetic not to go on any sugar, they become hypo, especially with the medications which are on, and that becomes dangerous. Um, a person who has a fit body will actually end up starting to utilize its body fat storage to actually start making sugar or its carbohydrate storage. So I think let's look at it from a perspective of a healthy person. I would never recommend sugary drinks for a healthy person. Why? It's because it's like that. I always look at the pancreas. Let's look at it from a diabetic point of view. I always look at the pancreas as having workers. So imagine there are 100 workers there. So every day, if you have 100 pieces of wood coming in, imagine it's a factory which actually builds tables. If you have 100 pieces of wood coming in, you have 100 workers, you actually have to put an output of 100 tables a day, right? But imagine as time goes on, your workers become less and less. So let's say you have 90 workers now. 100 pieces of wood is still coming in. You want to still produce 100 tables. So everybody slightly produces more than a table because previously is one wood, one worker, and one table. So now there are 90 workers. So some people have to produce a little bit more. At the end of the day, you still don't work too hard. But once it becomes a deficit of lower and lower, and suddenly you have only 50 workers coming in. Now, that means with 100 pieces of wood coming in, each fellow has to do two tables for you to get 100. So this is what the body is actually like. The wood which is coming in is actually your food intake. Your workers are actually your insulin cells or your beta islets of Langerhans, and your output is actually your sugar. So if you take less of intake, even though if you have 50 workers and let's say you only have 50 pieces of wood coming in, you only still need one person to fix one to get the final output. So if you put in less, of course, you're not only preserving your beta islets of Langerhans, which will produce your insulin at the end of the day, but at the same time, you're leading a healthier lifestyle. You're not overworking your body. So having an option of having a sugary drink and a non-sugary drink, I would go for the non-sugary. So there are a lot of sugary substances these days which they say, oh, when you take that, your sugar doesn't go up. But a lot of people forget in the long period of time, the sugar actually still goes up. They don't go up immediately. So I would always recommend go for normal plain water or go for drinks that have very, 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 very low sugars. As you look at these days, even energy drinks, they have low sugar content or no sugar content. I would go for the no sugar content because, of course, you preserve yourself. But again, please ensure that you're not actually having diabetes because if you have diabetes, you may need a low sugar drink to actually replenish so that you don't go hypoglycemia with your medications.
Well said, doctor, on the hypoglycemia part. Thank you. So we have another one by J.M. Lai. How to help people with eating disorders but still in denial. So probably that's an issue because when they have an issue like anorexia or bulimia, even if you tell them they have a condition, probably they will never agree. So I mean, as a professional doctor, I mean, probably you will look at it and you probably will know the kind of condition. How are those people who are in denial and then trying to think they are perfectly fine? What kind of help they can get? So that is what JM Lai is actually saying about it.
So I think the most important thing is you must get someone close to them to actually talk to them and convince them that something is actually not right. It's not easy, trust me, because even if you force that person to actually go and see a medical professional, they may just go, they will listen to whatever they say, and then when they come out, they may not take their medications or they may not indulge in any therapy which is prescribed. So I think the most important thing to any therapy, whether it be diabetes, hypertension, or even weight loss, or even eating disorders, is acceptance of the current condition, and then to move forward from there. I think that actually makes the mentality or mindset to be prepared for to be this on the long haul. So I think getting someone who's close to them, who can get to them, who can talk to them, who can reach out to them, is very important for them.
Right, thank you, doctor. That we have already solved that part. So we are going into the last two segment. Is anorexia fatal?
Very, very fatal. Um, I've seen a lot of people who get hypoglycemia, not because they have diabetes or anything. They just get hypoglycemia because they don't eat anything, and they actually faint. And by the time they go to the hospital, it's too late to revive them. The heart has stopped. A lot of them don't even have muscle bulk, because remember, the body is built in such a way that you can you imagine during caveman times they actually had to hunt for their food. So doesn't mean that if you don't get food that the body actually can't produce, and the body can actually produce sugar as well. But if you have already, again, imagine if you have no money in the bank but you still want to spend it, you can't. Where are you going to get the money from? So that is exactly how the body is. So if you have actually utilizes all your storage, you become anorexic, you become so thin, cacaxic. There's no muscle bulk. Even in fact, even some muscle can be broken down into to go into glucose as well from the body, and vice versa can also happen. But again, if there's no storage in your body, there's very little that can be done. So I think failure of kidneys, failure of systems happens because of all of this. So I would suggest that it is something which we have to look at very, very carefully. Anorexia is definitely fatal, not only because of low sugar, low electrolytes, low protein. They can get kwashiorkor. They suddenly get central obesity for no reason. It's kwashiorkor or marasmus, which is protein or even carbohydrate disorders. So it can be actually very, very fatal.
Okay, doctor. So that will be the last one more to go. So the another question that we asked by Esther, um, if I'm going to take protein, can I just buy it over the shelf?
Ooh. I wouldn't recommend that, because you see, over the shelf can be a few things. You can buy it from a supermarket, you can buy it from a counter, you can buy it from a pharmacies, you can buy it from a shop. Again, are these recommended supplements or products? We don't even know whether they're actually legally registered. I know Singapore is very strict with their registration. Malaysia is also beginning to be there with their strict regulatory, especially for registered supplements, especially. But I think at the end of the day, just going and buying something off the shelf without proper recommendation. I remember working with a nutritionist in pediatrics many, many years ago. And I remember they actually look at the patient. They may give the same brand and product, but there are different scoops. How many times a day do you drink? Or even if the same amount of scoops, how you divide it. So I think there are a lot of ways which you actually have to do this. I wouldn't recommend anything off the shelf. I would always go and see a nutritionist. Look at it this way: always go and see a nutritionist and a doctor, get a prescription, you know they will tell you what to do, and then go and buy. Why buy something, come destroy your kidneys, destroy yourself? At the same time, you don't even know when it's going to work, you don't even know how to take it, and when you finally go and see a doctor, you may actually end up paying more because that particular product which you have bought is not useful. You may need to buy another product. So why waste money? Might as well go get a proper prescription, get a proper thing, save your body, save your kidneys, save your body, save your organs. Get a supplement which is recommended, and also which is safe, and how shall I put it, suitable for you, than to go and get something off the shelf and try and fix it by itself. It's not a DIY do it yourself thing which you can actually do it. It's something which actually requires a lot of it requires a lot. Even I don't think any doctor would do it by themselves. They will actually consult a nutritionist or even an endocrinologist for that matter. So
I
why
think they
sh-
are
why why should you? Yeah.
I think they are the best person to actually to advise. Even if it's certain things that comes under nutrition, but I do not take it personally. I always send it to a nutritionist because I think the body is a very not only a complex but very expensive. There's
Yeah.
no price tag for a human body because if what something spoil, it's not just like a car. You can go and change it. It's more than that. Sometimes you have to wait wait until infinity. Probably you never get that kind of a spare part. Even if it does, somebody donates, and so forth. So I think it's very important. Again, I like to stress anything that is prescribed, not by a doctor, or someone else recommending you over the streets to take these to lose weight, or you see some popping the pills and say that you can lose 3 kg,
Over the
4
internet.
kg. Do not even get tempted. The temptation is high, but please don't get that, because it does a lot of damages in a short run, even a long term run. We never know. We got to do a study, to see what happens if someone takes a fat loss pill now, and then what happens in the next 6 years or 10 years or 15 years. Even to go a little bit more deeper, do not take ENT, those chemical substances, which is of course clenbuterols and so forth. They are very, very bad for the body, especially for the respiratory system. It opens up your whole respiratory system so that more oxygen goes in and you burn fat, right? It's just like a fuel for the car. But what happens that your heart rate has been elevated, your poor heart is working on, so you're putting a lot of stress on your heart. That can lead to myocardial infarction, which is heart attack. It can happen. So you trying to go for an aesthetic body, trying to lose weight, but you're creating so many other risks along the way. So it's not worth at all. Even if you need to take proteins, I know there's so many things right now in the net. People are suggesting proteins and so forth. But the always best person to ask and to make sure that it's safe, it's always a doctor, because these guys know what stuff to recommend, because they are named, they're professional, the number of years they have been in the industry. So it all requires that. Please take care of your health. Make sure you know what you're putting in. Doctor, any final wise words from you?
Stay safe, stay healthy, and always remember that if everybody thinks that it is a quick fix. If it's a quick fix, a lot of us won't spend actually years and years doing a master's or PhD, in fact, for that matter, to study something such in depth so that we can actually help the public better. I think there's much more to it. On the surface, it looks very simple, but it's much more complex than it. Each individual that comes in is unique, and of course, there is a unique way to treat them. Sometimes it may not be even needing to treat that particular disorder. It may be due to something anxiety and all. So I think if you treat that, you actually can treat the rest of it. So why bother with unprescribed or unverified supplements? Don't risk your body. Don't you deserve much better than that.
Yeah, doctor, I mean, sorry, I just have to continue on that. When you talk about that, there's certain companies, of course, it's always not good to mention names. Uh, Drink to lose. What is your take on this? Drink to lose. I mean,
Again,
literally, you don't need to drink and lose. It's protein drinks, but you
oh,
just got to drink and lose. The way I'm looking at it, of course, you have the basic recommended daily allowance or intake might be there, not too sure. But if you're just taking in liquid, isn't it more into a serious health issue? Probably you're losing not that amount of quality protein you might have it, or your cravings is going up. We just talk about binge eating. You are creating a path for these psychological effects to happen. What is your take on this before we end this show?
So basically, any supplementation, you see, the reason why it's called supplementation, what the word supplementation means, it's supposed to supplement what you can't actually take. For example, if you need X amount of proteins, but you're only about to eat this amount, you're only able to eat this much, so you supplement it with top up. So you can't actually, it's not a replacement. It's not a replacement, it's a supplement, it's on top of it. So if you're calling a meal replacement, that is what we normally give in hospitals. Total parental nutrition is a replacement meal. It is not a supplementation. So what we need to do is we need to know how much to supplement, because if you need this much and you're taking this much, you will need this much left. So that is the supplementation which you need. There's no point of you taking this much when you only require this much. At the end of the day, what actually happens is these further additional supplements will get excreted through the kidneys, and when that happens, that is when the damage starts. So why risk it all? I don't think it is worth any risk for that. I think it has to be prescribed. We have to know what is inside, and then at the same time, if it is going to be secreted by the kidneys, we have to make sure that it is not going to damage your kidneys.
Thank you so much, Doctor, for that information. I'm sure um, with such great topics, we can talk until the cow comes back home.
Yeah, very true.
Is the right quote to say that? Oh, the dog comes back home. I think we can talk about it. We can talk about science. I mean, it's a very interesting topic. I mean, thank you to all the viewers who's been with us for the past 1 hour 45 minutes. I mean, like I said, it's only planned for 45 minutes and 15 minutes Q&A, but it just run through, and now it's almost going to be 12 o'clock. I can
Yeah.
just wish you good morning already, Doctor, in another 10 minutes. But again, it's pleasure to have you in Kopi with Vans with such a short notice, and then we decided that this topic will be beneficial for our viewers at this point of time, because there's something that we never talked at Kopi with Vans. Even though we have psychiatrists, neurologists who came in, they also share the same view in terms of different how the body acts. But now what we talked about it, and what doctors, psychiatrists, and neurologists combine. Now we combine all these puzzle, and we know that, hey, this is more to it. It's just a tip of an iceberg. They're more in depth to it, to understand about steroids, understanding about certain medications that prescribed by doctors, or whether are we a own chemist, can we take certain drugs on our own self and lose that 10 kg. It's all question marks, but it's not really the worth that spending less and getting quick results. I believe in, if you want something quick result, that's always a higher risk. So rather take it 5 10 years. Even if it's supposed to take 15 years, doesn't matter, but as long that you are losing weight gradually by exercising, getting your cardiovascular stronger, getting your stroke volume, the amount of muscles on your heart gets stronger, you don't have blood pressure, your endocrine system is perfect, your kidneys is great, your psychologically you're stronger and fitter. I mean, what else can we ask for?
Agree.
Nothing.
Yep.
Thank you, Doctor. Thank you so much. I will catch you again in our next topic. We're just waiting for the pandemic to over, after which either you're going to fly down here, if not, I'm flying down there, and we're going to have real coffee with together.
Kopi with Vans.
Thank you, Doctor. Thank you so much. I will see you. I will see you again in a shortest period of time.
Sure, man. Take care.
Again. Bye bye. Thank you, viewers, for almost spending 1 hour 47 minutes. Even though the viewers for today is not many, I can see maximum viewers about 20. But the whole interesting topic is getting it done on a regular basis, and it is started not to just start and stop like a switch, but it is to stay for long term. And we have great topics coming up. I got great news to announce as well. I'm going to host a new show, which is going to be on a series of program, which I'll give you the link in future, which is going to happen in a couple of days. And it's going to be talk on food. We're going to talk about exercises. We're going to talk about different aspect of life, right? It's more on a holistic approach where it will benefit, and it's easier way to get people in touch is through social media. So social media is one of the best way we can use it for powerful exchange of informations, positive, and of course, things that's not productive, you can always put it aside. That doesn't concern us. Our concern is we just have to walk ahead and get things done. All right. Thank you so much for all the questions that came in. Please do share the video on your Facebook so that more people can be benefit this. It is supposed to be Tuesdays at 10 p.m., but unfortunately, Tuesday I was a little engaged, so couldn't make it. So yeah, it is on Wednesday. We have another interesting topic. I'm quite sick and tired of saying interesting every week, but it's going to be another interesting topic again. We're going to talk a little bit more in other details, not apart from fitness, nothing to do with health, more on knowledge a bit. Yeah. So stay tuned, and I'll catch you real soon on the next Kopi with Vans. As for now, signing off, Vans. Sayonara. Ciao.